Welcome to Pharmacy in Focus, where I will be having pocket-sized conversations on current topics and interests relating to pharmacy and the wider health sector. My name is Sharina Basan, bringing you Pharmacy in Focus on behalf of the Pharmaceutical Society of New Zealand. Welcome everyone to episode 2 of Pharmacy in Focus. Today I have Michael Hammond joining me. Let me tell you a little bit about Michael. After graduating from the University of Auckland, Michael started his career at North Shore Hospital, where he worked for a number of years in different clinical areas, before moving to develop and implement a clinical pharmacist facilitator service for the primary health organisation in Rotorua. He currently works as part of the COVID-19 pharmacy establishment team, leading the rollout of the COVID-19 vaccine and community pharmacy across the 3 Auckland DHBs. Michael is also the project manager for the quality improvement program, Safety in Practice, as well as a number of other primary care initiatives for Waitemata and Auckland District Health Boards. To support him in his role, he also works casually as a pharmacist at Waitemata North Shore Hospital. He is enthusiastic about learning and continuing education, being the first New Zealand pharmacist to complete the Diploma of Leadership and Management through the Pharmaceutical Society of Australia. He is also currently the Vice-President of the National Executive of the Pharmaceutical Society and Vice-President of the Auckland branch of the Society. Michael is passionate about patient safety and expanding the roles and services for pharmacy. Welcome, Michael.
Thank you. Pleased to be here.
Now, we've heard a little bit, a summary of your roles to date. Can you tell me a little bit more about your career journey so far and how you've ended up in your current role working across all 3 Auckland DHBs?
Yes, I feel like I've had quite an interesting career journey. I've done quite a varied number of different roles in my relatively short career, from starting out as an intern at a hospital pharmacy department at Waitemata. And I'd also worked in a community pharmacy as a student while at university, so I got some good exposure there as well. And as you mentioned, I worked through a wide range of clinical areas while at North Shore Hospital, and thoroughly enjoyed my time there. And then I was looking for something more, and looking for a bit of a challenge, and the role in Rotorua came up to set up the clinical pharmacist facilitator service, and I was like, oh, that sounds a bit interesting. It was very a blank slate. I kind of got to design it, be as much involved in the design of it as I wanted to be, helped write the job description, and just went for it, which was a really great experience. And that kind of started me down my patient safety journey, I think, in a way. And then after working there for about 18 months and setting up this clinical pharmacist facilitator service, it was running quite smoothly and quite self-sufficient. So I was, again, thinking about what's my next challenge going to be, and always seeking out something else to get my teeth sunk into. And at that point, I decided to move back to Auckland. And for some time, I went back to North Shore Hospital while I sought out a new challenge. And so while I was working back at North Shore Hospital, it was rather opportunistic, actually. A role came up being the project manager for a quality program called Safety in Practice, and I was encouraged to apply. And I was kind of thought, oh, I don't know much about project management, but patient safety is something that I'm very much interested in, and I think I could do this. So I applied for that role, and initially I actually got turned down. But I was, really strongly interested in taking on this challenge, and I pushed back and eventually got an interview, and then actually got the project manager position, which was really exciting. And
so you pushed your case.
I pushed my case, exactly. And then so that's what launched me into the world of project management in the healthcare sector. So create a really good balance of still being related to patient safety, related to medicines, related to pharmacy, but then on a wider scale. And as a project manager for Waitemata and Auckland DHBs, it's enabled me to be involved in a number of different projects during my short time that I've been employed there for, in that role now for I think three or so years, and including mainly being project manager for safety and practice, but then also during the COVID response, I've been working as a project manager as part of logistics, sending out swabs and PPE and all that for almost a year. And then now I've also been working as a COVID pharmacy establishment team, rolling out the vaccine across community pharmacies in Auckland. And so it's really been a ever developing role that's enabled me to work in so many different spaces, which is really exciting.
And you've mentioned your project manager role. You've mentioned the COVID-19 establishment team and rolling out the vaccines across the district. What would you say the demands are of your role currently?
So, I mean, there's a lot of work that goes on behind the scenes. That's, the unseen work to get all of these pharmacies over the line. There's quite a lot of demands at the beginning of the rollout, to write papers, to get approvals, to create all the quality assurance documents, to really have all the resources prepared to be able to then start this rollout. But then it's a continuing developing program of work with more vaccines being added, the conditions around the vaccine changing, and all those factors to consider. So it's a continually evolving piece of work, and so you've always got to keep very much up to date with what's going on in the vaccination space with COVID, and also the pressures that pharmacies are experiencing, and trying to respond to those as best as you can.
And recognising that, have you needed to put your safety and practice role to one side?
So given the current climate with COVID-19, the safety and practice program has been temporarily placed on hold, but we keep the website live, the resources are still accessible, and if pharmacies or the general practices enrolled in the program were wanted to seek advice or resources, they are still able to contact me as the project manager. So it's still on the side, but temporarily on hold.
Okay. Excellent. And you mentioned all the work that happens in the background. Are there quite large teams in the background helping to stay abreast of what's going on?
Yep. So there's a huge team involved in the vaccination program, and within our COVID-19 pharmacy establishment team, there's it's not just me; it's a team of us that are pulling this all together and working really, really hard to get it all across the line. But we've got a great team that we gel really well together with to produce this quite efficiently.
Excellent. That's great to hear. And what would you say your biggest accomplishment is to date?
So I used to always think that my biggest accomplishment was setting up the clinical pharmacist facilitator service in Rotorua, because that was literally from ground up to a service that's still running today. But in recent years, I'm still very much proud of that achievement. I think now is that with my team, we've got over 150 pharmacies across Auckland Metro over the line approved to deliver the COVID vaccine, and as a result, they've been able to deliver over 1 million doses of the vaccine in Auckland. So I know it's definitely not all my work, but it feels like an achievement to have helped enable that.
Fantastic, and a great achievement it is too. Just going back to your role in Rotorua, starting up that clinical facilitator role, how did you go about doing that? What sort of did you have some mentoring? Did you have some help in how to set that up?
So we it was myself and one other pharmacist who were employed to set up this service, and we had a very supportive manager, and the CEO of the PHO there is also actually a pharmacist, and so she has some really good insights there and had all the right connections to help us talk with the right people. So we did a lot of sector engagement with the general practices in the area, the community pharmacies in the area, about how they think a service like this could work. And there was also some models from around the country to help pull in parts from, and models from overseas as well to pull in ideas from, and how we could work it. And then we'd develop concept models and go meet with all the general practices in the area, ask them for an input, alter it, change it, go back to them, and then present it to some of the boards to see if they're happy with that model, and then build on it from there.
Fantastic. And how long did that whole process take until it was implemented?
It's hard to say from the date that it was developed to the first patient was seen, because we were continually developing the model and changing it. So it's hard to put a kind of defined time period on that. But I would say it was maybe a few 1 to 3 months before we kind of started seeing patients, but then we were constantly refining it and making it a better process, or adding bits in and expanding to other general practices and other types of services within that same realm.
It's certainly a great achievement to be able to starting that from the ground up.
Yeah, and I'm just so happy that it's still running.
Yeah, definitely. So we've talked about your 2 biggest accomplishments to date. What would you say are some of the challenges you've faced so far?
So I think one of the biggest challenges I faced in my more recent career is that I didn't have formal project manager experience when I came into my role within safety and practice. And so I was very much learning on the job, taking my transferable skills from pharmacy, but then the core project manager skills I had to learn while I was doing, which wasn't impossible, but it was definitely hard. And since then, I've gone on to get some formal project manager training to support that. And I think one of the other challenges that's kind of been faced, because I've always wanted to do more and get another challenge, sometimes I've seen it's been a challenge. Some people see me as quite young for wanting to do what I want to do sometimes.
And has that been something that's been quite difficult for you?
Yes and no, but it's about how I respond to it, and just using assertive behaviours and things to make that a non-issue.
Yeah. Excellent. Now, speaking of your young age, you have been a co-opted member of the Society Executive Board for a few years now, representing early career pharmacists. And you are now probably the youngest vice president the Society has probably ever had. How have you found this experience, and what have you learned?
So being co-opted to the National Executive and then moving into an elected position, it's been an invaluable experience in leadership and governance. And from when I was co-opted, it was such an incredibly eye-opening experience, again, to all that work that goes on behind the scenes, all the tables that and meetings that people are advocating for us are at. And there's so many moving wheels, moving cogs in the system. So I think that's been, really a fantastic experience.
And for anyone who's listening who doesn't know what the Society does, the Society provides primarily representation and advocacy to its pharmacists and technicians around New Zealand. They also provide professional support and advisory services, education and training, and recertification support as well. So in summary, that is what the Society does. Now, considering the role that you're on the executive board now, for anyone thinking that one day they would like to be in your position, what would you say to them?
I would say absolutely go for it. I think as a first step, you can get involved with your local branch and see if you like it at that level. But then absolutely, when election time comes around, I say throw your hat in the ring, put in there what you stand for, and give it a go. I don't think you'll regret it, and there's nothing to lose.
Totally agree with that. Now, as the Vice President who for the Society, who represents individual pharmacists and technicians across the sector, I would say you are in a pretty predominant leadership role. So what does leadership mean to you?
So to me, leadership means a few different things. I can't pinpoint it to one aspect. Firstly, it's about bringing up others around me. So it's about bringing other people's viewpoints to the table, and also it's also about being I don't like to use this word, but a visionary that has when you're working towards a goal that benefit more than just oneself. But ultimately, to me, it's actually about not being afraid to rock the boat and change the status quo. I really like using that saying at work and in lots of places. Just rock the boat just a little bit.
And you don't know what change will come of it, right? If you just rock the boat a little bit.
And if someone falls out, they weren't meant to be in it.
Nicely put. That's a very good analogy. Thank you. So one more question I'd like to ask you before we finish off this section is, if you could go back to when you first registered as a pharmacist and give yourself one piece of advice, what would that be?
So I think I thought long and hard about this, and always thought what I'd tell myself. But I think it should be to still don't be patient, and be patient, but don't settle. So not to wait passively for opportunities to come to me. Seize them when they come, and even small steps towards a goal are steps in that direction.
Very good advice. Thank you, Michael. So, Michael, now we're just going to go on to the second section, where we talk a little bit about, I guess, the details or the nitty-gritty about what you need to be successful in your particular role. So what would you say would be the skills that would be needed to move into your current project manager role?
So I think pharmacists have a lot of transferable skills into the project manager space. I think a lot of the key ones are, most pharmacists are highly organized, detail-orientated individuals. So those are some very key skills, because in a project manager position, you got to be across all aspects of the piece of work that you're doing, and so there's a lot of moving parts that you've got to keep an eye on. And I think pharmacists have a really transferable skill set there, and also with the attention to detail as well. And then similarly, other skills that pharmacists tend to be quite good at is project managers really need to be good at time management, and also they're very good at sector engagement and working with different people, different levels and different authority levels, so to say. So really good at that networking engagement side of things as well.
And what would you say to someone who doesn't have that project management experience or qualifications? I know you did say that when you first moved into a project manager type role, you didn't have that experience or didn't have the qualifications at the time yourself, but then developed those while you were in the role. So for someone else that doesn't have project management experience but wants to move into it, what would you say to them?
I would say it's definitely possible. I would always just focus again on looking at what your transferable skills are, because I know that you would have many transferable skills that would help you in the project management world, and it's about just having that chance to prove it. And I think you could always go down the route of obtaining a project management qualification prior to attempting to move, because some of the courses they're quite short, they're not too time intensive, so it's relatively easy to obtain some of them, and that could give you a taste of what it would be like. And but I don't think it's a requirement to have before you move into it, but it does help.
And considering that, how did you find your transition into that initial project manager role?
So it was a challenge, but as you may have figured out, I quite like a challenge, and you just have to kind of be ready to be willing to ask questions. There's no silly questions, and just making sure that you're doing the right thing. And sometimes Google can be your friend, not and finding out what's the right way to go about things, and also looking for if there's a buddy or a mentor in the workplace that can help you, who answer those questions and help you navigate the new workspace. This can often be benefit if it's not your direct line manager, but someone else who works in a similar area within the workplace, and it can be agreed for you to go ask them any questions you want in a non-judgmental space. That's going to while you're helping yourself while you're learning the ropes.
I know when we were having a conversation a little while ago, you did mention you had a lot of support in your workplace when you were moving into these roles. Would that be fair to say?
Yeah. So I had quite a bit of support from my direct line manager in terms of helping me upskill in that space. Yeah, lucky for me.
Yeah. And for anyone who is currently thinking, oh, it'd be great if I had a mentor to help me navigate what I want to do in my career, what would you say to them?
I would say, definitely seek a mentor out. There's huge benefits in having one. I wouldn't say don't expect them to tell you the answer. It's more that they're a sounding board to help you figure it out on your own, and a bit of guiding at the same time. But if you're able to find one, I would recommend that. And for early career pharmacists, there will be some resources coming out soon around this.
Watch the space, right?
Watch this space.
Excellent. Hey, thank you so much for your time today, Michael. I just wanted to end on one lighthearted question. I know you've got young ones in the family, and I know my daughter really loves fruit. So what is your favourite fruit? My favourite fruit is absolutely bananas. Bananas? And that's my son's favourite fruit as well. He eats 2 a day, usually. Yeah, certainly my daughter's favourite as well. I don't know what it is about bananas. One of the first words. Excellent. Well, hey, thank you so much for your time. I know you and your team are incredibly busy right now, so it's very much appreciated. No worries. It's been fascinating hearing about your experiences and interest in your roles to date. I think this conversation may have given some useful insight into people listening, and it'd be great to have them think about where their next career journey will take them. Thank you so much, and enjoy the rest of your day. Well, thank you, Sharina. You too.